Established in 2003, World Suicide Prevention Day is observed on September the 10th and aims to reduce stigma while raising awareness of the fact that death by suicide is preventable. The triennial theme for the years 2024 to 2026 is about changing the narrative on suicide. With that in mind, and to help transform the way we perceive this complex issue from one of silence and stigma to one of openness and understanding, in this video I'm going to be talking about the prevalence and impact of suicide in the UK, alongside some of the misconceptions that prevent us from updating our view of the subject. According to the World Health Organization, over 700,000 people die by suicide every year. In the UK, the Office for National Statistics, the National Record of Scotland, and the Northern Ireland Statistics and Research Agency publish annual reports that provide a summary of suicides according to country, region, and patterns by age. In 2023, there were 6,069 suicides registered in England and Wales. For the same year, there were 792 probable suicide deaths registered in Scotland, and in 2022, there were 203 registered deaths by suicide in Northern Ireland, representing an 8.6% increase across the UK versus the previous year, for a total of 7,063 people. Of this number, and as with previous years, 3/4 of deaths by suicide in the UK are men. Also of note is that the number of deaths by region is inversely proportionate to the level of deprivation, meaning there is a direct correlation between a person's socio-economic circumstances, gender, and death by suicide. When looking at these figures, you should also be aware that suicide rates are based on the year of death registration. For example, in England and Wales, only 39% of the deaths registered in 2023 had a date of death in the same year. This is due in part to suicides being more likely to need a coroner's inquest, and as a result cannot be registered until an inquest is completed, which has a knock-on effect of decreasing timeliness when compared with other causes. In my experience as a mental health first aid instructor and Samaritans listening volunteer, there are some commonly held misconceptions about suicide that either prevent us from having more accessible conversations or directly contribute to some of the numbers we've just discussed. Number one is that by talking to a person directly about suicidal thoughts, it increases the likelihood of them making an attempt. However, when we take a moment to consider the psychopathology of suicide, there are a couple of reasons why this is untrue. Firstly, this train of thought rides on the assumption that the person is aware of their circumstances. But actually, when in or approaching a crisis situation such as suicide, it's very common for a person to lose their sense of perspective, both on increased and ongoing risk factors in their lives, as well as the people and resources available to help. The resulting isolation and hopelessness can leave them stuck in a rut, in a state of despair, and at rock bottom, without a clear idea of how they got there. This is to say that by taking the time to directly ask a friend or colleague about their experience, it's more likely that you are providing them with an opportunity to reflect, organise, and take control of thoughts that in some cases they didn't realise or acknowledge they were having. The second thing to consider is the stigma associated with death by suicide. Stigma being an umbrella term for anything that prevents a person from accessing the help they need. In this case, the language many of us still use concerning suicide fits into this category. For example, the term committed suicide is not only stigmatising, but semantically inaccurate, as it relates to a time when taking your own life was illegal under English and Welsh law. However, that hasn't been the case since the Suicide Act was passed on the 3rd of August 1961. The accumulative effect of the language we use, combined with other forms of social stigma, makes it more likely for a person experiencing suicidal thoughts to withdraw and suffer in silence, perhaps under the impression that nobody would understand. So, assuming you have a rapport with the person and have taken due time and consideration to approach them in a psychologically safe environment, consider asking directly about suicidal thoughts with a genuine intent to want to understand, as an invitation for that person to put down a rucksack full of weights, so that they might unburden themselves by sharing the load. The second misconception concerns warning signs. Case in point, how many times have you heard about somebody taking their own life and the survivors or people that knew the deceased said something to the effect of, "We never saw it coming"? Unfortunately, having lost a close family member to suicide, I count myself among the aforementioned. Now, the truth, in my opinion, is that in some very specific circumstances, it can be extremely difficult to spot the signs in time to make a difference. But for the majority of cases, my own included, people tend not to wake up in a suicidal crisis. And a combination of the following means that we can essentially be colourblind to a situation that's been unfolding in front of us for weeks, months, and in some cases years prior. In addition, the act of acknowledging another person's reality, in particular with something like suicide, and especially if it's with a loved one, can be intimidating. In some cases, consciously or otherwise, it might seem easier to ignore, skirt around, or brush the subject under the carpet in the hope that it will go away. At the same time, how can you approach a situation if you don't know what you're looking for? Well, as with all mental illness, it can look very different from one person to another. But the following are some warning signs for suicide we should all be aware of. This includes casually or explicitly talking or writing about suicide, giving away possessions, tying up loose ends, risky behaviour such as drug or alcohol misuse, acute or chronic stress such as bereavement, divorce, debt or loss of employment, previous attempts and sudden recovery. So, we know that suicide is a problem both around the world and here in the UK. And we've also just covered some of the things to consider if we're going to update our view of the subject. To put this into practice, we may also benefit from clarity on the help available to the people that need it. Because in the words of Rethink Mental Illness Chief Executive Mark Winstanley, the last thing people need when they or a loved one are in a crisis situation is uncertainty about where to turn. With this in mind, and quite timely for this video, the NHS announced on the 27th of August that millions of people, including children, who are in a crisis or concerned for a loved one can now call 111, select the mental health option and speak to a trained mental health professional. The number connects to a local team of handlers with mental health training alongside nurses and clinicians who are available around the clock. The helpline also has specialists from local children and adolescent mental health services. The team can then organise a mental health assessment, send out a crisis team and flag up help available in the local area. A familiar alternative to the NHS helpline is available through Samaritans, which is a free and confidential helpline where you can be connected with a listening volunteer at any one of their 200 branches UK-wide. The idea is that the caller can have a non-judgmental conversation, either about the crisis at hand or about any number of lifestyle-related issues, including family problems, job-related issues, suicidal ideation, alcohol dependency, and financial worries. One of the things that makes the Samaritans helpline so valuable is that callers are able to speak to a complete stranger, devoid of any bias or social stigma they may have faced when expressing their thoughts and feelings to someone more familiar. They'll be met with warmth and empathy, acceptance, and listened to by a team that is dedicated to achieving a vision that fewer people die by suicide. Please remember that if someone's life is at risk, for example, they've seriously injured themselves or taken an overdose, or you do not feel that you can keep yourself or somebody else safe, call 999 or go to A&E. There are links to several other sources of crisis support in the description of this video. In the meantime, please remember that suicide is a permanent solution to a temporary problem. And so, if you've gotten value from this video and you're passionate about changing the narrative, please share and consider subscribing.